So it's that time of the year again, the holy and blessed month of Ramadan. Now, for religious reasons and during Ramadan, we learn to be patient, we learn to control ourselves and to discipline ourselves. We learn the value of food, and with that, we learn new things that make us better human beings. We become more disciplined. So what better time than now to also try and adopt healthier habits, and especially ones that revolve around food. So limit your food portions. Limit your food options to ones that are healthy, to ones that are nutritious. And possibly after Ramadan, even after it passes, those healthy habits will continue to live on with us.
Bismillah ar-Rahman ar-Rahim, Barak alaykum shahar and happy Ramadan. Today I'm going to talk about the dyslipidemia, i.e. the lipid problem or the cholesterol problem. It's a wide and broad problem and difficult to understand, but I'll simplify it as much as I can. So to know which lipid abnormality we have or cholesterol abnormality, you have to do a specific test for that. The tests include in the blood test, the cholesterol, the total cholesterol level, plus the triglyceride called TG in the blood test, the HDL, which is the good cholesterol, and LDL, low density lipoprotein, is the bad cholesterol that might lead to atherosclerosis or blockage to the vessel and might cause the heart attack and the stroke. Regarding those stuff, to know which lipid abnormality you have to do the lipid test, and after that the doctor will decide if you have a problem with the high cholesterol and the bad cholesterol, or you have triglyceride only, or you have both together. Okay, so those the lipid abnormalities might happen, and some people have low HDL, which is the bad, the good cholesterol will be low, and this might lead to problem to the heart if it's very low, and this is also a congenital issues. So the lipid abnormality, usually it's either related to genetics, so they're born with this level. So we have people at age of 5 or 6 discover to have very high cholesterol at that time. But this also could be acquired. Acquired mean related to specific diseases, such as one is the hypothyroid. The thyroid gland is not functioning well, and there is decrease in the hormone. This is number one. Or they have something called nephrotic syndrome, i.e. protein in the urine, and leads to swelling in the feet and also high cholesterol. Or some liver abnormality might lead to high cholesterol. Regarding the triglyceride, another type of problem, those usually either genetic, they're born with it, or they might develop that relate to specific things happen. Such as what? Such as one is obesity, like gaining weight. Number two, uncontrolled diabetes. Number 3 could happen during pregnancy. The high triglyceride and cholesterol all will raise during pregnancy. Or some medications such as the corticosteroid, cortisone, sometimes they take it for whatever reason. Or they might develop the hypertriglyceridemia because, or high triglyceride in other words, because of high fatty meal and consuming a lot of sugar. Also, alcohol might lead to increase in the triglyceride level. So why we are worried about the cholesterol medication, the cholesterol problem? Does the patient will feel anything? Usually the patient who has lipid abnormality or hypercholesterolemia or high triglyceride, usually they don't feel anything and do not complain from anything. the problem that the high cholesterol might lead to blockage to the vessels in some cases depends on other situations, such as if they have diabetes, they have high blood pressure, or they have genetic predisposition for that, or with age. So the problem with the heart might happen with multifactorial things, too many reasons, one of them also the cholesterol. Other thing is regarding the high triglyceride issues, it might cause pancreatitis, inflammation to the pancreas, and this a life-threatening problem, okay? So we recommend that anyone has lipid abnormality should check their cholesterol regularly and follow their medication regularly. After the break, we're gonna talk about the hypercholesterolemia issues and fasting. Welcome back. Thank you for staying tuned. So now I'm gonna talk about people who's taking medication for high cholesterol or high triglyceride with fasting. So usually the medication for the high cholesterol usually taking at night, and some of the medication can be taken at any time of the day. So what we recommend for them, we recommend for them to keep taking their medication and should not stop their medication during the fasting period. This is number one. Number two, we recommend for them to have a healthy eating and exercise during Ramadan. Why is that? Especially for people who have very high triglyceride, because triglyceride level more than 10 might lead to an inflammation to the pancreas called pancreatitis and might lead to hospital admission or intensive care units admission. So this is not something simple to happen. This life-threatening inflammation happened to the pancreas, and this has happened because of very high triglyceride. So why high triglyceride might happen other than genetic predisposition? It's the main reason because of food. So during Ramadan, a lot of people consume a lot of simple sugar, okay? So all those juices, Vimtos, shakes, this is all high in sugar. Plus they consume a lot of high fatty meal. So the high fatty meal, this will lead to increase in the triglyceride. Plus they might gain weight, so this is also leads to high triglyceride, and this accumulate all the problem and might lead to a major problem. So that's why I recommend for them to have a healthy lifestyle, not only taking your medication, because without diet for mainly triglyceride problem, usually the diet is the cornerstone, not only the medication. So please follow and instruct dietitian recommendation if you have problem with that high triglyceride. Also, we recommend for them to have regular exercise, so they might have to stabilize their weight, or they might lose weight also. This will help them and will try to reduce their calories once they do all of those activity during Ramadan. So happy Ramadan and Barak alaykum al-shahar.
Life puts us through experiences all the time. Now these may be difficult or rather breezy experiences. We're living through the holy and blessed month of Ramadan right now. So let's use this experience of Ramadan to use it as an opportunity to learn, to grow, and to adapt. To learn, to grow, and to adapt to be healthier human beings, ones that take healthier food choices and ones that choose to work out time and time again. And maybe, just maybe, after Ramadan has passed, we will continue to live on with these healthy habits.